Many people believe that vaginal tightening is purely a cosmetic procedure, but that's not true. Vaginal tightening procedures, whether surgical or non-surgical, are also performed for several medical reasons. Hello everyone, I am Dr. Chaitali Mahajan Trivedi, a laparoscopic surgeon and a cosmetic gynecologist practicing in Mumbai. Female health issues are very less talked about in India, but thankfully now, especially in the last decade, the awareness is increasing. Vaginal tightening is one such topic. There are several misconceptions associated with vaginal health. The vagina is normally stretchy and flexible, so it generally gets back to its normal shape. But as the process of aging affects our skin and body structure, laxity or looseness is observed in the vaginal area too. Also, after childbirth, females experience loss of elasticity and weak pelvic muscles, because of which certain medical concerns also arise. Now, these medical concerns include thin vaginal walls, vaginal dryness, stress urinary incontinence, and problems in an intimate relationship. So, for some women, vaginal tightening can rather be a necessity. There are different treatments available to tighten and rejuvenate the loose vagina, which includes both surgical and non-surgical approaches. Firstly, let us discuss non-surgical vaginal tightening treatments. Non-surgical vaginal tightening procedure includes laser treatment or RF therapy. In this treatment, a wand or a probe is inserted in the female's vagina and is rotated to deliver the laser beam or energy. This laser beam heats the vaginal tissue and creates painless micro tears that stimulate the production of collagen and elastin fibers. The overall procedure restores the strength and elasticity of the vaginal walls and improves lubrication. The non-surgical approach is a painless procedure and does not involve making any incisions or cuts. So there's no downtime associated. One can immediately continue with the daily activities. It is performed in a gynecologist's clinic and takes about 10 to 15 minutes. However, multiple sessions will be needed to see a significant difference. Now let's talk about the surgical approach, that is vaginal tightening. This procedure is commonly performed to reverse the changes caused to the vagina following childbirth. The procedure tightens the vaginal canal and enhances the vaginal sensation. This surgical method provides both cosmetic as well as functional benefits. Urinary incontinence or urine leakage is a problem that many women silently suffer from. It is mainly caused by loose vaginal muscles. So, with vaginal tightening, one can find relief from this problem also. Like any other surgical procedure, patient selection plays an important role in determining success. It can also be combined with perineoplasty. Now, what is perineoplasty? The perineum, that is the area of skin tissue that extends from the vagina to the anus, is often injured or torn during childbirth. This surgery is often performed in conjunction with vaginoplasty to tighten the posterior muscles and remove the excess perineal skin and the distal vaginal mucosa. So, it helps to relieve the feeling of looseness and also improves the appearance as desired. What aftercare is required after surgical treatment? Okay, once the anesthesia wears off, patients will be able to walk and move immediately following the surgery. Patients are advised to keep ice packs over the incisions to reduce and minimize the pain, swelling and bruising in the first 24 to 48 hours after the surgery. To relieve any discomfort after the surgery, pain medications will also be prescribed by the surgeon. 1 week of physical rest is suggested for better recovery before going back to normal routine activities. However, patients will be advised to limit strenuous physical activity like weightlifting or vigorous exercises for a few weeks after the vaginal rejuvenation surgery. Patients will also be instructed to wear loose cotton underwears and pants for comfort and also to keep from disturbing the incisions. The patient must avoid sexual intercourse, swimming, tampon insertion, using a jacuzzi, hot tub or a bathtub for at least 6 weeks after the vaginal rejuvenation surgery. As the procedures we are talking about target the most delicate area of the body, I come across questions like, what are the side effects of the treatment? Are the results permanent? Is the recovery smooth? And so on. See, vaginal tightening or vaginal rejuvenation procedures have been beneficial for many women. The results are great. But as we know, the vagina is made of muscles, just like other areas of the body. It is prone to become loose with age. These procedures cannot prevent the effects of natural aging process. This fact is applicable for both surgical as well as non-surgical approaches. Even though the surgical approach has long-term effects, the natural aging process will eventually lead to results wearing off. So, follow-up sittings are most important. When we talk about the risk involved, vaginal tightening treatments are safe and do not involve any serious risk when performed by an expert surgeon who specializes in cosmetic and reconstructive gynecology. The procedure requires complete assessment and testing, which includes a basic physical examination of the underlying medical conditions. Patients' expectations related to the results are very important. A medical history and the overall health status. So, as a gynecologist, I also suggest my patients to follow certain pre- and post-operative care tips to get the optimum results and speed up the recovery process. The choice of treatment completely depends on an individual's need and the expectations of the results. An experienced gynecologist can definitely help in clarifying any doubts and answering questions that one may have regarding vaginal tightening treatments. So, consultation is a very important step. Now, to sum up the whole thing, vaginal tightening has several benefits, such as it treats the urinary incontinence to a certain extent. It treats the symptoms of vaginal atrophy like thin, inflamed and dry vaginal walls. It also helps to reduce vaginal infections. It improves vaginal laxity and the sexual pleasure. So that was all for this video. If you have any questions, please drop them in the comments below or directly get in touch with me through the contact details given below. Please do not hesitate to share this video with your female friends and family. For more videos on female health, subscribe to my YouTube channel and press the bell icon to get notified every time I upload a new video. Thank you.